सकता मेरे को। पॉज द शेयर कर देते हैं।
इसको आप
हाउ डू यू स्टॉप शेयरिंग? न्यू
Stop
शेयर?
नहीं, इसको आप ऊपर कैंसिल कर दो तो स्टॉप शेयरिंग हो जाए।
ओके,
हाँ, हो गया। Ina, my PPT is visible.
no, it is still not yet.
हो गया बस। कौन ये करेंगे? चलो स्टार्ट हो गया।
क्या चीज मिल गया आपका पेन? हाँ मैंने चिपकाया था उस पे दीदी।
हाँ हाँ ठीक ठीक ठीक, थैंक यू।
Hina, am I audible?
Yes, ma'am.
Yeah.
Yes.
Binu sir?
Yes, ma'am.
Binu sir, I'm not able to share my screen.
आप लेफ्ट हो गए सर मैडम।
हाँ जी सर, लेफ्ट हो गई थी।
अब नाउ मैम।
Yes sir, now I'm able to share. It's already 2 o'clock. Binu sir, shall we start?
Yes, ma'am.
Yeah. Okay.
एक ही सिस्टर को बोल के दोनों काम हो जाएगा, दोनों आजू बाजू में रहेंगे, एक इमरजेंसी में आ जाएगा, एक उसमें हो जाएगा ना, तो ऐसा सब दोनों सर है ना। और वो इमरजेंसी के सिस्टर्स को बता देना ना कि इनको अपन ने डाला है, इनको रिकॉर्ड कर लेना, 9 to 1 कर लो, तो फिर 9 to 1 ही दो बच्चों का ना, नहीं तो फिर वो ज्यादा करवा देंगे। 9 to 1।
Good afternoon, everyone. This is
Good afternoon, ma'am.
Good afternoon.
Very good afternoon, everyone. This is Dr. Anu Gaba, Professor, Amity University, Haryana. Hope you all are doing well. So
Good
first of
afternoon.
all, very good afternoon. First of all, I would like to thank each one of you for joining the today's session.
Emergency, no?
I feel great proud to say that this session has been organized by Nursing Scholar Society. I bid a very warm welcome to our renowned speaker and delegates who took out their valuable time and joined us today to be a part of this event. We are honored to have you all with us. Finally, the auspicious day has come. Put an end to our impatient anticipation and tireless preparations for this event. I feel that nursing professionals organizes such events to enlighten the young minds and promote the participation of students at all levels. Today is what? Today is 4th February. So today is World Cancer Day. This is a day that unites people, communities, and entire countries to raise awareness and take action. The theme for today's day, that is World Cancer Day 2022, is closing the care gap. Close the care gap. See, awareness is the first step towards handling any problem. So when you come to a life-threatening disease like cancer, the first step towards its prevention is awareness. As a modern civilization, we have come up with a cure for everything, but still the life-threatening problem of cancer remains intact. In such a scenario, creating a community that is aware of this threat is quite important. So it's exactly towards this goal the World Cancer Day is dedicated. It aims at inculcating in us all first an understanding regarding the severity of cancer, and then promotes its prevention, detection, and treatment. So let's make sure that we all contribute our part in it and pave a way towards a better global health environment. So welcome you all once again. Now it's time to introduce our guest speaker. We have Miss Hina Dutt with us. Welcome, Hina. Welcome to Nursing Scholar Society.
Thank you.
Hina has come. Done her higher diploma in oncology as a manager, clinical experience at CL Healthcare, focusing on training and development with clinical quality. Her aim is to bring excellence to clinical operations, audit compliance, research, and awards. She has worked as an oncology nurse in oncology and radiotherapy department in PGI Chandigarh. She has worked as a nurse manager in oncology care and liaison radiotherapy unit, Meadow Private Hospital, Dublin. She has worked as an oncology counselor, trainer, and quality assurance oncology in BLK Hospital, New Delhi, learning and development lead and operation manager at CL Healthcare, New Delhi. She has worked as a consultant, cancer care platform development, Prozilla Healthcare. She has worked as a consultant, center head training nursing attendant, healthcare at home tower. Welcome, Hina. Welcome to this webinar. Over
Thank
to
you so much,
Hina.
ma'am. Thank you so much. Thank you everyone for taking out time, and thank you, Dr. Anu, to oblige me and actually take me as a speaker to this wonderful forum. And I'm sure we have a wonderful discussion today. So before we start, so can I ask everyone to mute yourself? I think
please,
it'll be...
please, participants, request you to mute yourself, right? And If you have any questions, so you can, enter in chat box. We will we will have question answer session at the end of this webinar. Yeah.
Right.
Please. Yeah.
The elongated, the experience is not as longer as you have explained it so nicely, Dr. Anu, and it's always been privileged to be associated with you and always learned from you many things. And so I am, so as Dr. Anu has already said, like I've been working into various capacities into oncology and learning and development as well. So presently, if you ask me about present assignment, I work with HCL Healthcare and I take care of the clinical excellence department. Okay, so I'm just going to share my screen and let me know once it is visible to all.
Visible, ma'am.
Yeah, it's visible, Hina. Yeah.
Perfect. So before we start, I would actually try and iterate as when the session is more as an interactive session. It's not a teaching session where am I going to teach you about cancer or anything, but it's a forum where I think we are trying to map the young minds, where we are trying to evolve from where the original nursing is and what all opportunities do we have available in the environment. And that's what the discussion we would like to have. And any expectations before we start, or anything from the participants I would like to hear from you before I start on my discussion. It's more of give and take kind of a session. So over to you. Anybody would like to actually say what do you expect? What is oncology nursing, or anything, whatever comes into your mind?
Ma'am, I want to ask.
Yes, please.
Ma'am, in the recent day, why the cancer cases are increasing more and more? So what is the exact cause that I want to know?
Okay, so that's more of the reasons, as in medical reason, as in why the epidemiology or why the incidence of the cancer is increasing. But that would have a different kind of reason, as in environmental reason, as the type of food habits we have, the exposure, the exposure to the carcinogenics is available in the market. So there would be, I think, huge lot of list because of that. There's no standardization. There is no enlisted, documented
हिंदी में भी
things.
पता नहीं आई होगी
अच्छा.
नहीं आई होगी होगी
Okay.
देख
Okay. Again, I think, can I request everyone to mute yourself? Okay. So we are here to discuss about the World Cancer Day and the emerging role of oncology nurses. So have you ever heard about oncology nursing? We have heard about critical care nursing, dialysis nursing, obs and gynae, emergency nursing. Anybody, have you ever thought about a specialty called oncology nursing? Yes or no, anyone? Okay, I believe the most of the participants would be the students or the staff who are already working into the hospital.
Yes, ma'am.
Okay. So now World Cancer Day, the theme for 2022 to 2024 is closing the care gap, as Dr. Anu has already said. This World Cancer Day, we recognize the power of knowledge. So this is what is the thought process about this year, right? So they say that they want to, the organization looks that the whole world looks Cancer Day as in to recognize the power of knowledge. We know that every single one of us has the ability to make a difference, large or small, and that together we can make real progress in reducing the global impact of cancer. So now when we are talking about our role, we are not really so there are always few controllable and non-controllable things, right? So if in case when we are talking about the increase in the cancer, we don't really have much to say in it, because at the provider end or at the healthcare end, we are actually at the premises where we are actually going to cure the cancer. Like we are at the role where I am going to talk about the treatment to cancer and my role to it. So this is where they think that everybody has the ability to make a difference. So when we talk about the nurses, we are the role of nurses to close this gap is your role into cancer care. Okay. So if you see here, the cancer theme is always for 3 years. So this is how they have divided it, right? So 2022, we are saying that we are going to put it as the realizing. Then is uniting in the next year will be uniting our voices to take actions. And the third one will be together we challenge those in power. What does it mean? So start me in the beginning only, like what are the reasons that the cancer burden is increasing, right? But what do you think? Do you think that India has good data about it? Do we have any perfect figure saying this is the percentage of breast cancer, this is the percentage of lung cancer? Do we have this kind of data to actually start? We always talk about evidence care. We always talk about evidence nursing care or evidence around the care, right? Yes or no?
Yes, ma'am.
Yes.
Yes, ma'am.
So I want to ask is, do you think क्या हमारे पास ऐसा data है इंडिया में? Do you think we have that data?
No, ma'am.
No. And why do you think we don't have that data?
Ma'am,
हमारे
because
पास
there are ma'am, because lots of people, if they are getting cancer, people don't want to die, want to go to their hospital to detect their diseases.
Yes.
Ma'am,
So right, basically there is a problem where there is no mechanism where the repository can be taken. So data will only come if in case there is a place where everyone is going to register the problem, right? So you are right that people don't want to come out in the public and say that I have this problem because there are lot many taboos attached to it. Like, they think that bata ke zyada ho jayega. Then they don't want their relatives to know about it. So there are n number of reasons. So when we talk about the cancer theme for 2022, it is saying realizing the problem. First is we have to realize the problem. The first year of closing the care gap is to understand and recognize the inequities in cancer care around this, about having an open mind, challenging the assumptions and looking at the hard facts. So that means किसी भी problem को solve करने के लिए first I have to understand what is the gravity of the problem, how bigger is the problem. What are my various cuts? कहाँ पे problem ज़्यादा है, कहाँ पे कम है? So when we're talking about cancer theme, this year we are going to put energies to say realize the problem. What is the inequity in cancer care costs lives? There, if you ask me what is the reason why cancer is increasing, number one, people are not coming out. Number two, because the cost of treatment is so very high, they are not able to cope up with the treatment. So that is one thing they're going to talk about. Second is people who seek cancer care hit the barrier at every turn. So what are the challenges? So pehle is like, do you know it is cancer? Do you know which doctor to? Do you know, is the doctor going to give me the right treatment? Is there a standardization in the treatment? So there are so many barriers. So first is cost, second is the barrier. Then is third is income, education, location, and discrimination based on ethnicity, gender, sexual orientation, age, disability, and lifestyle are just a few of the factors that can negatively. So now that means we are trying to realize what are the factors which is being negative towards the treatment. Cancer kyun बढ़ रहा है? Because people are not getting the treatment done. People do not know they have cancer. If they know, they don't have the money to get the treatment done. If they have the money, they don't know where to go, which is the right place to go. If they know which is the right place, they don't know कि वो सही treatment भी मिल रहा है कि नहीं मिल रहा. ठीक है? So this year has been taken care where we are going to put all the problems together and find out the gaps which is affecting everyone. Okay? We are talking about the patient and we are talking about the loved ones. Do you think when someone has cancer, it is only about one patient or it is about the whole family? Tell me, किसी को कैंसर होता है तो is it because सिर्फ patient is suffering or the whole family is suffering?
The whole family is suffering, ma'am.
Right. So the whole family is suffering because उनके मन में डर है कि we don't know that this person is going to survive or not. Okay. So we are going to find out the gaps which is affecting the patient and the loved ones. Then these barriers are not set in stone. So that means these barriers are not कि मैंने आज 10 point बना दिया and that's end of it. No, these can keep changing. Okay, this is the year to question the status that and help the reduce the stigma. Do you think stigma is there? What do you mean by stigma? Do you think people are even open in today's environment to openly say I have cancer? People can easily say I have stones, I have kidney stones, I have pneumonia. Do you think people go out and say I have breast cancer, I have lung cancer?
No.
बताते हैं लोग?
No, ma'am.
Because there is a bigger stigma attached to it, because it is still counted as a taboo that if I tell it to someone, people think that it is communicable. So this year has been put in to find out that how can I reduce the stigma, to listen to the perspectives of the people living with cancer and their community. So we are also going to put an effort कि patient को भी सुनेंगे and relatives को भी सुनेंगे. So what are their challenges so that we can put everything together. Okay. So once we have this problem realized, then next year we'll talk about कि करना क्या है. Like, then once I have all the problem, then I'll have a plan कि भाई अब करना क्या है. And then next will be the final process in the picture. So this is what the theme of the cancer for 3 years look like. So that means I'm closing the gap starting from the beginning to the end. Okay. So next is, why are we discussing this? We are trying to say what is the importance of my nurses, my oncology nurses. Do you think that we have a specialty called as oncology nursing?
Yes, ma'am.
Yes,
Okay.
ma'am.
How many of you, any of the students, if in case I can ask, if I can ask, in your 4 years, how much do you talk about cancer nursing? In your complete curriculum, how much studies is only pertaining to cancer?
Third year.
Third year, but how many?
Ma'am, ma'am, more than
a rough picture. Maybe my figures, I did my graduation like probably 17 years pehle. So my figure will be totally different. But presently, how many hours, how many educational hours, or I'll say how much practical hours you get in the oncology area?
15 days for practical.
15 days for practical. So that too, half in radiations and half in medical oncology, right?
Yeah, right, ma'am.
Yes. So why I'm asking is, if you look at the larger picture, out of 4 years, the stress is so less on this kind of a field where it is coming one of the biggest disease burden of the country. Okay. So that it tells what is the importance of emerging oncology nursing as a specialization. So what I want to talk about is what are we going to make a difference? We always say empower the nurses. Do we say it or not?
Yes, ma'am.
Yes, ma'am.
What do you mean by empowerment? We always say as a leader.
Providing authority to someone.
Authority. With authority, do you think authority comes in with experience or with knowledge or with both? Or just with both? So empowerment, when we talk about empowering the nurses, I'm going to talk more about are we actually putting effort to upskill ourselves? So empowerment comes with upskilling. So that is where the stress is that, if we are talking only pertaining to oncology nursing, this is how my junior nurses should be thinking, that I need to upskill myself to reach a stage where I feel empowered. not because you are only 10 years of nursing into nursing that you are at a staff nurse 1 level, 2 level, 3 level, that you just keep on increasing with the years. The empowerment comes with upskilling. How many of us do we put an effort to upskill ourselves? So that's a question to you. How many of us do we think about studying forward once our graduation is done?
Yes, ma'am. It is necessary.
Yes.
So it is very much important that we need to upskill at every stage, no matter what. I am 15 years down the line, I'm 20 years down the line. You should always keep upskilling. So if you always look for someone where you would like to reach, so you always see that the person can never grow, can never be empowered until and unless I am upskilled. And upskilling comes only with your own motivation. Okay. So if I talk about some facts, so India is in the need of 4.3 million more nurses by 2024. This is a fact given by Mr. Dilip, who is heading our nursing unions. And if we go by WHO data, what is the strategies proposed to it? So if you talk only about India, we are going to need Sirf India mein by next 2 years, we would need existing, say, 4.3 million more. Okay. So you can just imagine what is the importance of your profession. You are so much in demand, right? So, but do you think this demand can be fulfilled? So what WHO has proposed that there are few strategies. How can I go is, I've just highlighted few. First one is growth in the number of nurses in the workspace. So that means I need to increase my nursing workforce. Second is increase in the participation of trained personnel in workforce. So one is nursing degree means that you're a graduate, okay, you can perform anywhere. But I am talking about specialization. So I need to have specialized workforce so that I know my oncology is taken care, my critical care is taken care, emergency is taken care, or dialysis is taken care, right? So that is proposed by WHO. Then is balancing the skill mix. I cannot put all the perfect staff at one place and new staff at one place. So I need to have a a proper mix-up of the experience, proper mix-up of the doctor and nurse experience, so that I can give a best experience to my customer or my patient. So upskilling is a process. How can we do the upskilling? It is a process of learning new skills or refining existing skill sets to enable a person to continue practicing with ease. Upskilling is also essential when adapting in the times of change or crisis. So if we talk about senior people, so if I see Dr. Anu, so do you think that she had just been sitting on her BSc degree, which was probably so many years first?
Okay. Good.
Right? So we need to upskill. So if you want to look at the growth pattern, that will directly be linked to the upskilling of your career. Okay. Can you mute yourself, everyone, please?
Participants,
Okay.
you are requested to mute yourself.
Okay. No problem. Okay. So what is the process we are going to follow? So every nurse who, once the nursing degree is done, there are 3 important pillars. So one is your education. Then is what is your skill set? What are you doing to upskill yourself? So when we are talking about basic nursing education, what does it give you? It gives you employment. The moment I am a nurse, I can apply for a job. Okay. But the moment, do you think anybody who has not finished the nursing degree, do you think they can work as a full-time nurse?
No, ma'am. They are not.
So they can only work as in GDAs or as a nursing students or as in, they are not a full-time professional, right? So basic nursing education is the first step what I need to do. But what does it give me? It gives me employment. Okay. Then is skill. If I earn a skill, so I have worked in say example, I have worked in oncology area, it gives me a skill. It tells me how to do the care of CVADs, how to take care of palliative care patient, what is radiation. So it gives me skill which is like not present with all the other nurses. So it gives me assertion. So that means it gives me power. If I know how to tackle my cancer patients, I am a step edge. I have an edge over the other people who are just the basic nursing education. Yes or no? And what does it give about upskilling? Upskilling se kya hoga? Upskilling se we are going to talk about empowerment. So it is a cycle. Everybody who is a nurse will get a job, but that job is not going to give you assertion. That job is not going to give you empowerment until unless you have skill, until unless you are upskilling. I have a skill. I learned oncology 15 years ago. But if I don't brush my knowledge, if I don't bring my degree up with the times, it's not going to give me that empowerment to talk about it. Okay. So my request to the young minds would be like, I just make sure that we have 3 things in our mind always. I have the degree, I need to skill myself, and then I need to upskill myself. Okay.
Yes, ma'am.
Okay, so now we are talking about oncology. So oncology is, or we say, critical nurse specialist. Okay, so it demands what? It demands sophisticated knowledge and strong decision-making skills, but it also calls for a limitless amount of compassion and kindness. So what do you mean by compassion and kindness, and why it is linked to cancer? Cancer is something a person already knows that he may not survive, but still he is fighting or she is fighting. Similar is care, like, the relatives or the family, they are fighting with their destiny kind of a thing. They are giving the treatment, but they are still know the fact that cancer is something, it can never be out of your system. Right? So until and unless I have that compassion and kindness towards this reality, I cannot be a good oncology nurse. Professional possibilities available are as diverse as patient population they serve. So they say that professionally with upskilling myself, these will change as per the requirement of the population. Some specialities what is available in oncology nursing is radiation oncology, hospice, and palliative care. So if I may ask, what is palliative care? Anyone?
Palliative care is mainly when the patient is in mental
care, which is provided symptomatic treatment only.
Right. So, but do you think palliative care and end of life care is different?
Kind of. I mean, symptomatic treatment only, just no cure for cancer.
Because sister,
just have to care for symptoms only.
Right.
Yeah, we used to only give the treatment for the symptoms, and for there is a
perfect. Yes. So palliative and end of life care, it really goes hand in hand. But palliative is something where I know I do not have a solution to the problem. So I am only doing symptom control. I am not fighting myself to provide treatment to the disease, but I am only doing symptom control. So that is palliative care. And when we are talking about hospice, hospice is a place where I am focusing on the palliative care. So if I talk about the complete oncology nursing, cancer is not only about chemotherapy. Wow. So it has various wings as in medical, surgical, radiation, home care, hospice care. So this is all under the umbrella of oncology nursing. So we have radiation, we have hospice, we have preventive and detection, which is a huge role it plays in the oncology, because I can cure cancer if I know it at the right time. But once the cancer has spread, then it is difficult for me to control. So there is a role of oncology nurse in the prevention and detection. Patient education, genetics. Do you think genetics is involved in the cancer? Can you name any one cancer which is because of the genes?
Yes.
Anyone? Can you name any cancer which is because you have those genes in your body? Because
Ma'am,
you're
blood cancer.
sorry, blood cancer.
Breast cancer, ma'am.
Breast cancer, yes. So breast cancer is one of the examples which is carried on the genes. So BRCA1 or 2, they are the genes which if blood cancer is not for sure, ऐसा नहीं है, but then breast cancer is something, it is definitely carried over the genes. Okay. Sorry, just give me a minute, please. Okay. Then is psychological care, psychosocial care, pain management, home care, neuro-oncology and surgical oncology. So what is home care? What idea you have about home care?
Ma'am, home care is a patient cancer suffered and symptomatically care, normal routine care provided by bed bath care, catheterization care, and medicine given.
But do you
prescribe format in?
Right, but anyone else? Anybody? Can you tell anything specific about home care to oncology? What the idea behind is to make people know that there are so many wings which is available in cancer care for nurses. So home care is not only about supportive care. It's not only about end of life care, or it's not only about that I am only going to give the help with activity of daily livings. So there is a wing where in home care we are providing chemotherapy at home. We are providing dialysis at home. We can even we can give supportive care in terms of antibiotics at home. So this is all under so home care itself has a speciality of oncology home care, cancer home care. So if you look into the depth, it's not only the home care, it is not related to the the primitive home care that it is only for the help of people. It is not only helping with ADLs. Okay, so that is again a separate wing which is available for the nurses to grow. Then is neuro-oncology and surgical oncology. So what is the best, what do you think, the choice of treatment for any cancer? Would it be medical, surgical, radiation? What do you think?
Surgical. Treatment depend on condition severity basis, but best treatment is surgical intervention and immediate medication intervention is best.
Right. So if you ask me, what is the easiest way to take the bulky cancer out of my body is surgery, right? But it really depends on the medical condition. Can we do the surgery or not? Is it the right? Sometimes it is the extent of the disease. Sometimes it's comorbidities. Sometimes it is the location of the cancer where we cannot really do the surgical intervention right away. So, but do you think normal med-surg nursing would be different than surgical oncology nursing? It would be largely different, because when I'm talking about surgical oncology, say for example, we have done a breast cancer surgery. So it will be largely also preventing the lymphodemas. If it is a colon cancer, then we are talking about colostomy care. If in case it's a head and neck cancer, we are talking about feeding difficulties. So that is why the speciality of surgical oncology would be completely different. So in India, do you think that we have the separate wings like this?
No.
Should we have it? Do you think we should have it?
Yes, ma'am.
Yes, ma'am.
So for the growth of the nurses, for the care of the betterment of the patient, to bring in specialization, these are the changes we need to work on. We need to propose, we need to make the things happen. The leaders have the responsibility that they create it, they provide the opportunity for the juniors. The juniors have the responsibility, or the new nurses or the novice nurses, that they have the responsibility to skill and upskill themselves to say that we are different and we can do it. We can bring the change in the care of the patient, right? So oncology or the clinic nursing specialist expectations. So what are my expectations is, it's not only about the clinical practice, it is also about a multidisciplinary team. It is about providing high quality, patient-centered, timely, cost-effective care. So when I'm talking about nursing in cancer, it's not only about that I only give the injections, I only give the fluids, I only take care of the ADLs. I need to know about the diagnosis. I need to know the growth of the diagnosis. I need to know what is the prognosis of my disease. I need to know, is my medical doctor doing chemotherapy? Why dose reduction? Why first line of treatment? Why second line of treatment? Why surgery? Why radiation? So this is something what makes oncology nurse different than a normal med-surg nurse or any other graduate nurse. If you want to earn, if we are going into the specialty, this is, I need to develop into my mind that I need to grow as a multidisciplinary team. Okay. They provide tailored care depending on the patient level of need. So it depends what is the need. So I can only provide a tailored care if I know myself. If I do not know myself that what radiation is being given, what gyri it is being given, how many cycles, I cannot really help my patient. And if you cannot help your patient that way, then it doesn't make you an oncology nurse. And how does it come? It only comes with your upskilling. So CNS spend time would be clinical activity is 60%. 17% is your education. Education here is not your graduation nursing. Education is what you have done specifically to upskill yourself. Then is management is 19, and then is 4% is your research. Patient outcomes can be improved through all 4 activities, and capturing impact will involve looking at all the 4 areas of activities. Okay, so basically, if a nurse is able to cover all this, that makes you an oncology nurse plus the clinical skills. So why oncology nursing is needed? Because person needs a patient-centered or a person-centered care. We need to know about conditions, comorbidities, various treatment patterns. I need to know the psychosocial needs, patient pathways. What do you mean by patient pathways? Anyone? Patient pathways means if I have a cancer at one stage, what is my first line of treatment? If I say I'm giving chemotherapy, my first line of treatment is ACT. If it is node negative, triple negative, I am going to give a different kind of chemotherapy. So this is not that we are going to depend on a doctor to tell us what chemotherapy to be given. I should be empowered that I should know the pathway. Ye nahi jayega, so second line treatment is this. Second line fails, this is the third treatment. So this is what places the oncology nurse forward. Okay. Okay. Any questions, anyone? So I've just put down as a 10 steppers how to upskill yourself. So the first step is first find your passion. What do you want to do? So if I know my passion is oncology, I should know first that what is my passion. Then is once I know my passion is what, then I have to make a plan on it. Until and unless I just think I've done my graduation, okay, I'm doing my job, that's my plan ends there. Then you have not found your passion. You need to go down to your step 1, make a plan. Then you go forward, find a mentor, find a person who can help you, find a person who you can look to, who can guide you. Okay. Then make a network so that it's very essential to have a network to help you understand what is in the market. How am I going to help myself? How can I get help? Who is the best person to help me? Then be visible. You have to be visible. You have to say that what you need, so that people who can help you should also know that you need that kind of a help, so that we can upskill. Social media can be used. Yes. Education. Without education, I cannot really go up the ladder. Then is professional and personal development. I need to grow. I need to grow my profession. I need to grow in my personal development as well. Then be open to signs. If you think that you are getting a sign that, yes, this is my pathway to grow, this is how we grow. Okay, everyone. Anyone, any questions? I think I'm the only one speaking. So maybe we'll just put it to discussion before we end the session.
No, ma'am, everything is clear, ma'am.
So the point of discussion here is like, we should know that what specialties are available. We should not really be sticking ourselves only to the basic nursing. It's our effort to upskill ourselves. Once I am skilled and upskilled, I have various avenues open for me. So that's my kind of a takeaway message for you all. Over to you, Anu ma'am.
Thank you, Hina. Thank you so much for the wonderful presentation.
Any questions, anyone? I see a lot of junior nurses. I see a lot of senior people. So from your experience, from your doubts, or maybe if you have any questions, anything pertaining where we can help you, or we can be like, share our views on it, please be open on it.
Anything you want to ask, you can ask, or you can, if you want to write something, you can mention in chat box. We can discuss.
Ma'am, may I?
Yes, please.
Yeah, please.
Yes, ma'am. Very nice in organizing this kind of talk to us, ma'am, because this makes an eye-opening for us. But actually speaking, in India now, so much of courses on palliative care or end-of-life care or holistic care, so many things have come up, and especially in oncology, also like special courses on chemotherapy, so many things have come up. And Madam Hina, when you spoke, you were asking about whether statistics are available. Yes, statistics are available, but it was not updated. It was like 10 years before, and 10 years before statistics is available. And as you rightly said, many of them, due to stigma or taboo, they don't come out and say. And they say there is a boil. There is like a kind of a projection on my overhead. That's what they wanted to say. They don't even say that it is a cancer. So all these things, whatever you say, we agree to it. But there are so many courses coming up. And as you said, something about patient pathway, we here learn about clinical pathway, but not specific to patients as such in India. So I think, ma'am, so India has to much more updated, and such kind of treatment modalities or whatever the treatment things that is going on should be more opportunities to be given for the oncology nurses to update themselves, to upskill themselves, and to get empowered to provide quality care to the patient. This is my opinion, ma'am. Thank you.
You rightly said, ma'am. I think just putting my experience together, wherein I've worked in India, worked in abroad, back to India. So the only thing I would say, the difference is not, definitely I said there are few controllable and uncontrollable reasons. But if I talk about my nurses, we should not stop our path because of uncontrollable reasons. So if the opportunities needs to be created, if I upskill myself, I can ask for those opportunities. When I go down my experience, I would say it's more like, people are even reluctant to upskill, but they need empowerment. So that is also not fair from our field also, that I would say just asking for empowerment where I am not putting any effort to upskill myself. Definitely there are reasons where there are operational reasons where the opportunities are less. The n number of reasons are there, but we need to create our path. If I have that zeal, if I upskill myself, if I have the knowledge, opportunities are definitely created. So if I thinking from managerial perspective, thinking from specialization perspective, it's really the nurses who have to put their step first, then the opportunities will definitely come their way.
Yes, ma'am. Thank you.
Thank you.
Hina, there is one question for you. Someone has mentioned, like, ma'am, will you please guide me through a good book for MSc nursing. Basically, they are asking for the oncology part.
Yes, I can probably submit a list of literature to you, ma'am, and maybe you can share with the participants, and that will be helpful for them. But to be honest, if you ask me, I'll be honest. Presently, if you ask me if I am a MSc, I'm not a MSc. So I think Dr. Anu, you'll be the best person to guide them on books. If you ask me, I've done my BSc, I've done my higher development in oncology, and I'm pursuing my MBA. So that's where I am, but I can definitely check and get back to you on that.
One more question is there. Kindly explain the target therapy.
Tablets, yes, it's so the recent guidelines are we were always talking about medical, surgical, radiation, but the new things which are out is targeted therapy. So targeted therapy, the next part in treatment cancer is they understand that many of the cancer, they have a particular target, or you say, if you want to relate to a lock and key hypothesis. So those cancers where lock and key hypothesis fits in, I can use various tablets, which are largely the targeted medicines. So that is one. Number two, the tablets are the hormonal tablets. So there are few cancers which are triggered by hormones. Right. So say, for example, breast cancer, ovarian cancers. So these tablets cannot be given to all the cancers. It really depends what kind of disease, and do we have the right data fitting in where I can give those tablets.
Okay. Hina, one more question is there. How to counsel a family who cannot afford cancer treatment?
So presently in India, we have so there are different wings. So there is corporate, there is private segment, there is a government segment. So the costing would definitely be an issue with private sector when you don't have a panel. The similar can be little lesser in the government segment, but the only point is the queue is very long. Right. So that is why in the present world, there are few buffer systems available. If you can get a consult and the same chemotherapies can be given at home, because if you are giving at home, the pricing of the drugs is something which is in your control. There are few other things where you can bring the cost down, but this is largely a gap in our healthcare system, which we cannot really comment. But if in case you are looking for an advice for someone, maybe someone, I would only suggest is get the treatment started and look for the home care services and the people which can be, because chemo is something you cannot really give it anywhere. You need to have a special oncology nurse to give it so that there are no side effects. So stopping the treatment because of the cost can be an issue. When you don't really have a money, you can't do anything, then is government segment is the only answer. But if you have less money and you still, I would say, don't stop the treatment, but find for alternatives. But definitely not really taking the hit of unsaid medicines where you do not even know that what is inside those pudiyas. So that's, I would say, a sheer wastage of money.
Hello.
Hello,
ma'am.
Good afternoon.
Hi.
Can you hear me properly?
Yes, ma'am.
Okay, it was nice organization on this special day.
Request to all of you, can you speak one by one?
Yes, it's overlapping actually.
Yeah. Mrs. Krishna Veni?
Yes, ma'am. Good afternoon, ma'am.
Very good afternoon.
AIIMS Patna is having a surgical oncology, madam.
AIIMS Oncology, definitely it would have. We've lost your voice.
Hina, she is working with AIIMS Patna. So
Okay.
she was saying they are having a very good, oncology, surgical oncology department.
Oh, very good. I think
Mrs. Krishna Veni?
Yes,
Mrs.
ma'am.
Krishna Veni? Yeah,
Yes.
please.
Yeah, ma'am. We're having a separate wing for surgical oncology, ma'am. So last 3 years it's functioning, ma'am.
So good. It's so good that I think.
Surgical oncology, that's what I thought to share that information.
Okay. Okay, no surgical. Yes, it's actually good that people, like, if I talk about the private sector, it's definitely well in place. If you ask me, in Delhi, it's very well placed in Delhi or in metro cities, but it is coming up in government segment as well. It is really good. I think that's how we are all are evolving, and
Yes,
everybody is understanding the importance of specialization.
yes, ma'am.
In a last question for you, can we give a chemotherapy to pregnant women? Will it affect the baby?
So, if in case that is the situation, there are few medications which can be given during the first trimester. So, it's not really a generalized or a blanket kind of a rule for this. So, it really depends what medicine are to be. It really depends on the chemical of the medicine. So, there are only very few medicines which can be given during pregnancy.
Please enlist the name of few medicines, please.
We cannot really say, to be honest, like, generally I should not give you any wrong information, because this is something it has to come out with from a doctor only, number one. And the other thing is, generally, if in case the child is not a precious child, like, there are few people where they had been waiting for a child for so many years, and those kind of a things, the choice would always be to, like, not to carry the pregnancy forward. But if in case there is a situation like this where the parents are adamant that no, they want to carry the baby along with the cancer treatment, then it really depends on the discussion between the clinician, the oncologist, and the patient, because it's hardly two drugs which can be given, like, and that too, if in case it's a breast cancer, I can still give. But if you ask me lung cancer and give me the treatment, the choices would be very less.
Okay, ma'am. Okay.
Okay.
Hello, ma'am.
Ma'am, मेरा एक question और please.
Yes, please. One by one. Both of you can ask, but one by one, please.
Okay. First
Sorry,
of all,
ma'am, मैं
I
आपको
will
थोड़ा disturb कर
congratulate.
रही हूँ बीच में.
Okay, so I think, Ankita, if you can take a pause, I think maybe the other one, because he's been trying to speak from the last 10 minutes.
Mr. Sunil. Yeah, Mr. Sunil.
Yes.
Yeah, please.
I especially congratulate to organization because you have taken nice topic on a special day, World Cancer Day, and it was executed also nicely. Secondly, say congratulations to the speaker. Her experience, she is giving best examples. And third, very important, that the young generation who is participating in this session actively. My question regarding, we are mostly thinking about the treatment, but we have very fine measure, that is preventive measures. So through our new generation, we can spread the information about prevention of cancer.
Right. Very rightly said. Very rightly said, Mr. Sunil. Yes, preventive segment is something which is, so I always put myself as in controllable, uncontrollable. So preventive, which is something which comes in your controllable factors. So that is why if you look into the newer guidelines also, there's a lot of stress on prevention of cervical cancers, prevention of, like, timely mammograms being done. So this is all something it's even the government has highlighted, and even as you said, the newer generation, the new nurses, they should also put more effort into the preventive segment. So look for the preventive medicines also, preventive health.
Zeba, you want to ask something? Zeba, you want to ask something? I think,
Yes,
yeah, please.
Yeah. मैम, मुझे ये क्वेश्चन पूछना था कि जैसे कई बार ऐसा होता है कि हम कीमोथेरेपी दे रहे हो और फेस पे स्पिल हो गया, तो क्या वो डेंजरस है या इट्स सेफ?
Definitely dangerous hai, Zeba. So that is why we said oncology nursing, because oncology nurse should know chemotherapy extravasation. मतलब leak हो गया तब क्या करना है, आपके ऊपर spill हो गया तब क्या करना है. So there are various protocols which are to be followed in oncology nursing. That is why it makes a super specialization.
तो इसका prescription क्या है ना, बट स्किन पे अगर होता है तो भी डेंजर है.
Yes. So it has the capacity. So say if any chemotherapy itself, it is a carcinogenic itself. So it is called cytotoxic medicine, right? Cytotoxic, it's a other name of chemotherapy. So cyto means it itself has the capacity to kill the cells. Okay. So, but the only thing, the trigger is it has to recognize the bad cells. But for chemotherapy, all cells are cells. So if it is spilled somewhere or if it leaks into the veins, it will kill the adjoining or the adjacent cells also, wherever it comes in contact with. Okay, so there is a protocol. If in case number one, whenever you are administering a chemotherapy, you need to wear the full PPE gowns along with the shield. But still, if there is a spill, the protocol says you have to just wash it with good splash of water. We don't really have to apply anything. And the only thing is, if it is, irrigate your eyes well, irrigate your skin well. If in case there is any irritation or something, you have to contact a dermatologist.
Okay, ma'am.
Okay.
Thank you, ma'am.
Thank you. I think Ankita was another one. She was trying to ask something.
Zeba was there.
Okay.
Yeah. This is all about question answer session. Thank you so much, Hina. Okay. We have Binu sir with us. He is president of NSS. Binu sir, welcome to the webinar. Welcome to the webinar, sir. So I request Binu sir to say a few words.
A very good afternoon. I don't know people who have joined from different zones. So good afternoon, good day to everybody. It's a great pleasure to see everyone. Learning is continuous. And in this pandemic, all are learning virtually. Hope it is not by chance. It is by choice. Learning is by choice, not by chance, even if it is in virtual learning. And I would like to congratulate Dr. Anu Ghoba ma'am, Professor, Amity University, Gurgaon, Haryana, for organizing and being a background from the starting conference and making all the minute changes and making it in a very good way. So I congratulate ma'am for the success of this conference. It's a great timely conference on the same day of the theme. We are very lucky to have Mrs. Hina ma'am, clinical excellence, pathology, a right expert person who has shared various views. So I am very thankful from the whole society for Hina ma'am for being present with us and enlightening us with such a wonderful related to the cancer aspects and stressing that knowledge is lifelong. We should empower ourselves and gain. There is no way other than that. Empower yourself, and learning is lifelong. So I'm very grateful to Hina ma'am for giving a wonderful section on the World Cancer Day. Thank you, ma'am.
Thank you.
It's a great pleasure to thank all the delegates who have joined with us and always supported us in all the webinars. So it's a great pleasure to thank all the delegates who have joined with us. I'm very thankful. Next, I'd like to thank, of course, for the success of any program, the God Almighty's presence. I'd like to thank each one who has done behind the stage, front the stage for the success of this conference. Thank you all. Thank you, ma'am. We have shared the feedback link also in the chat box. So you will be getting certificates of the conference in the email ID which you have set. So automatically after filling the feedback form, you will be getting the certificates also. Thank you,
so
ma'am.
much.
Thank you.
Thank you so much, sir. And thank you everyone for giving me this opportunity. And let's just keep upskilling ourselves. That's my motto. Yeah. Thank you.
Thank you so much. Thank you so much, Hina. Thank you so much, sir, for supporting and everything. Thank you so much. Yeah.
Thank you. Bye, everyone. Thank you.
Okay, bye. So shall we? Yes, sir. End the meeting. Yes. Thank you, sir.
Participants, all of you have filled the feedback too. Anyway, we will be sharing in the WhatsApp group also.
Thank you.
Yeah, I will
Thank you.
share. I will share. Yeah. Okay. Thank you so much. Thank you.
Thank you. Thank you.
Thank you, sir.